Welcome back to SUPERSTAT. Today we're going to talk about something we're seeing more and more of in the virtual world of social media, and that is some people getting a little crazy with medical knowledge or lack thereof, perhaps. And every week it feels like there's a new viral post, a new alarming headline, or a new claim that spreads faster than the science behind it. And, we could say that some of these individuals are a little couillon. We would say that in the South to mean they're just maybe not all there in terms of their information, perhaps. And one example that kind of caught our mind and a lot of the attention of the social media narrative was that in the state of Utah, they passed a bill to allow unvaccinated blood for transfusions. And so this is why we at SUPERSTAT feel that conversations in the laboratory medicine sphere really matter. So let's get into it.
Further, I do want to slow down for a moment because this is the exact type of medical conversation on social media that can easily get off track, and oftentimes it does. So recently, there have been a wave of posts suggesting that Utah passed legislation allowing unvaccinated blood to be used for transfusion. But it was framed in a way that implied that this was either new or emerging information and put patients at a safety risk. And when you see headlines like this, people outside of the laboratory medicine, and particularly outside of the blood bank community, could see it and feel alarming depending on how the graphic looks, and there's a bunch of blood or things like that. And without context, which really matters in these circumstances, things can go viral, like Dr. Nelson said, and just get away from us. So this is exactly why lab professionals like us need to enter the chat and be a part of conversations like this. Because in laboratory medicine and transfusion medicine specifically, vaccination status has never been recognized as a transfusion safety risk. Blood donor screening in the United States and globally is built around identifying transfusion transmitted risk. And those are bloodborne diseases like HIV, hepatitis B and C, syphilis, West Nile virus, and a few other pathogens that have been proven to transmit through blood products. And these safeguards, blood is very heavily regulated, highly tested, and there's safeguards layered into every part of the process that are evidence-based and continually monitored.
And I'm glad you mentioned that. And the people don't realize how regulated the transfusion services are, how regulated blood bank is. So just something to kind of make sure as lab professionals you're educating along the way, but kind of as lab professionals and leaders in healthcare, we have to kind of have that responsibility to kind of pause, kind of evaluate, and kind of ask some just basic kind of questions. So, I mean, things along the lines of what is the science and what do the experts say? Okay, and what's the actual risk? And then an actual risk implies thinking about just not getting the therapy, getting the therapy, different approaches, but thinking about these things. And then also the big thing too, what is just people simply being the loudest squeaky wheel and kind of being the noisiest person in the room.
Yeah, I think you bring up a good point. I think also there's this idea of, especially I think that this comes out of COVID, and people, some people are anti-vaccine and some people are pro-vaccine, and then what if what they have in their blood gets into my body, and then all of these types of things. And I'm not saying I don't want to put down any kind of patient or public perception of just misunderstanding of certain things either. You want people to come ask us questions. I think where it gets concerning is when you have policy discussions specific around donor choice language and transparency efforts, or even a political motivator or driver. And that kind of splits the narrative away from what is an actual biological risk to patients. because that distinction is very critical. And, the key point is vaccination status has never been, is not considered a transfusion safety risk. So are we just spinning wheels with grease? Like how is this, what is this meant to accomplish, I guess, from a policy standpoint?
And at least when I just mentioned, I mean, there is that balance. You kind of touched on it, that balance between what the patient actually needs and what they want, along with what the guidelines are, and not discounting one perspective of things versus, okay, this is the standard. There can be a middle ground, but it's got to be rooted in science and technology.
Yeah. I think when you see posts like this, like I said, sometimes it can be to provoke fear or reaction out of individuals. And we see that a lot on social media. And there's a bigger issue here because sometimes information like that can move faster than the expertise. And when that happens, that's when fear decides to fill the gap. And then you get hysteria and people commenting and then getting riled up and things like that. And as laboratory professionals, we can't afford to be passive observers when misinformation is touching spaces where patients can see this information, because people will come to your lab and have these questions, and they'll come to your hospitals and have these questions. And we are the scientists, we are the quality stewards, we are the behind the scenes, in front of the scenes experts on patient safety when it comes to laboratory practices, safe practices, and blood bank standards. And so we need to be vocal.
Well, I would hate for a patient to come in. I mean, I think about the scenario all the time where we do have to have that conversation already with patients of like, oh, I don't want a blood transfusion. I don't want anything that's not mine. And sometimes there's a religious aspect to that. Totally respect where individuals are coming from and where they may be in their space. But you want to make sure that they're informed in that consent process and understand like, your body needs blood and the hemoglobin and the oxygen carrying capacity. And like there's things that we that are going to be real downstream ramifications if you don't get it. We're already having that counseling. Mm-hmm. So this is like a new layer of complex to that counseling, because if someone were to ask like, well, is it vaccination free? Like like what do you do in that moment?
Yeah. And that does make it a little tough that you have to be informed of these things. So you both, Stephanie and Melody, you guys both make excellent points just about being prepared in a sense of for what some of the patient questions can be, because people are, like Stephanie kind of alluded to, kind of going off of, oh, well, I heard it here, or well, I heard it here. And what makes things particularly challenging at points is just that social media, it's how quickly you're retweeted, or not, now it's X'd, or I forgot what it is, but how many likes you get, how many impressions you get, how quickly it spreads, because that's that part of the algorithm that goes viral, so that they're seeing those cases of, oh, well, I saw this one non-scientific story that talks about unvaccinated blood and I need that, or my beliefs are this, but their physicians or their care team not preparing them for, okay, here are some options that we have for you prior to like a major surgery or something. So being kind of aware of this thing. So as lab professionals, by the time we've actually done that consult, we've actually pulled the literature, we've done the review of the guidelines and validated the facts, post has moved on, and we're on to the next wild, somewhat maybe routed in factual statements. Some are just completely out there, but it just keeps turning over so fast, it's hard to kind of keep up.
Yeah, I mean, our access to various points of view, which is good, right? I'm not, we're not advocating censorship or anything, but like I think that it's good for people to be able to share and have dialogue. That's important. You brought up a good point about maybe there's not enough counseling on the front end for individuals about like the autologous options, right? Like you can donate blood for yourself for your procedure. Mm-hmm. Like maybe that's what they need, or whatever else. If you really want to verify that something's quote unquote not vaccinated blood. I also think, with post-COVID, I mean, we've just been pulled into a social media storm. I'm not sure as a laboratory community we navigate that well. I also don't think that even some of the people that are very visible on social media from medical perspective consider like the laboratory medicine point of view all the time when they are giving their opinions. And so like claims about blood shortages being caused by vaccinations or like misinterpretations, obviously with COVID testing, we had like false positives and screening tests and what does that actually mean? And then I think like LDTs lately, like what is a lab developed test? I had someone tell me, like, well, there's a modified test and then there's an LDT. And I'm like, well, if we've modified from the IFU, like it is an LDT. Like, you know, so it's like really hard to kind of get people to understand. So I think, I don't know, Steph, like, what do you think? It just seems like there's a lot.
Didn't change. It was the narrative online. And that's the important distinction that we need to make. And that's the biggest risk for headline medicine, right? Is that laboratory medicine is complex. There's a lot of nuance to it, and it can't be dwindled down into one single emotionally charged sentence. Everything that we do has a lot of layers, and we already went over that, and a lot of nuance, and certainly blood bank is no different.
Yeah, and I think for people who are listening, even people in our community from laboratory medicine, like how do we fact check something like that for your friends in a way that's, you know, not condescending is really important because you want, again, open dialogue in medicine is so important. Just because someone doesn't believe whatever you believe or even like understand the concept in the way that maybe you do, that does not negate how they feel because this is their care and that is their body. And like, we need to have awareness of that. And I just think it's good for us to remember to pause because if you immediately feel like alarmed or angry or shocked and it's like a medical related post, it should be your first signal to slow down. You do represent your healthcare community and you also represent your organization, right? And so sometimes that strong emotional pull is often how misinformation spreads, but it can also be like, oh, well, I'm not going to go there because they think that I'm, you know, they would never tell me, you know, what I need to know or have a conversation with me. Like, I think it's so crazy lately how things have gotten, but you really have to remember, like, people see us in the medical field. And so we need to be the ones that really like embrace facts and lead with facts and rational, like calm posting.
Yeah, and I like that you touched on the fact that there needs to, and we've kind of fed this through the conversation, just having like a mutual respect. Just because somebody doesn't share your beliefs, then you can't really discount them. I will caveat that with, I mean, if there are huge public health concerns that can impact others, but we need to have larger conversations. But those still need to be not shouting at people, but actually giving them kind of the facts. So we covered step one. So step two is with some of these outraged articles, go to the primary sources, look at where they're getting their information. Because the fun thing is I've seen a couple different places where people have gone to the sources and they're AI generated articles. The source doesn't exist, the paper doesn't exist. So you've got to actually look at where this information is coming from. Why are they trying to incite a reaction from you? It's kind of a big thing. So instead of relying on that repost, which is easy to get when you're in that Instagram or Facebook's reel swipe thing to go, oh my gosh, look at that. But you actually have to look at the bill language. You have to think about the different compliance and the guideline groups. So FDA has blood safety guidelines, AABB, which is one of our regulatory groups and just one of our professional groups for blood bank. They have standards that you can go to, that things are being held to, and even that got to give us scientists some credit, the peer-reviewed literature. So we do all these extensive experiments and things to try to prove things are working, to get therapies out there. And our critics are pretty severe to make sure that that is the most accurate information. That can be a tough process to go through and a little emotional when you're like, you look at their review, you're like, oh my gosh, reviewer too. Why do you want me to? But it's to maintain that high standard. So you look for those peer-reviewed articles and then kind of ask yourself, am I reading interpretation or am I reading the source? That's always very important because those are two very different things.
And let me tell you something. When Meg the Stallion and Clay allegedly stopped following each other, people fact checked the heck out of that to see if they were still in a relationship. And so, as much as we are fact checking the things in celebrity lives and pop culture, we need to fact check the other things that we see online. And we are the subject matters of expertise on these things. So I like those questions, that Aaron just said to ask yourself. Just pause and say, is this biologically plausible? Mechanism of risk? Is this something that blood bank and transfusion medicine is already monitoring? We know that they're a heavily regulated department right now. Has the AABB or the FDA issued some type of safety alert? Have I been seeing this in my other professional circles? And in the case of vaccination status and blood donation, the scientific community has already identified a pathway for, identifying transfusion risk. And that's really what matters, is that you stop and pause and, put some investigation behind it.
Yeah, I mean, for our listeners, especially if you're early in your career, if you want a fact-finding checklist, we like our little lab check, type of phrasing, which is really, look for the original source, assess the biological plausibility, and then benchmark against regulatory guidance. If you can't clear those 3 steps, we really should pause before we amplify anything. And really, you should pause before you respond to someone. Give people the gracious assumption, and you don't take your level of education for granted, or, when you're entering those conversations, make sure that you're really doing your due diligence.
Yeah, exactly. And if just remember lab, if you didn't catch that, it spells lab. We're very clever here on SUPERSTAT. But it's kind of thinking about, for work, you wouldn't, there's points where you pause before sending an email, kind of take that same level of let me think through it. And that's kind of what we're kind of stressing. So I'll add, of course, I have to add one more layer. So check who is doing the interpreting. Is the information coming from, like we've kind of mentioned already, reputable sources, scientific bodies? So like a transfusion medicine expert is always someone to look out for. Another healthcare professional. Is this coming from a regulatory body? Because if it's coming from one of our regulatory bodies, it's based in fact-driven data that's there for patient safety. So it's undergoing all of these extra steps. Or is it being primarily driven by commentary from the outside field, which is very easy to get stuck in that because emotions rise and you can just keep going and things can kind of spin out of control. So expert proximity does matter.
Yeah. And we do want to be clear, like Melanie already said, we're not dismissing public questions. Like curiosity about your healthcare and about what's happening in healthcare is always appropriate. You do need to advocate for yourself and your family that you were taking care of. And, be curious about the processes because questions about your safety are appropriate. But we do owe the public and we owe it to each other to have evidence anchored conversations, not fear amplified speculation.
Yeah, and I think, it doesn't just stay online. I think this is really the point. It shows up in patients' questions. It could show up in donors thinking that they need to be. The worst case for me is like donors think they have to be unvaccinated to donate blood, in which case, like, we already have a shortage. We don't need people thinking there's another reason why they can't donate. One in 10 people will need a blood transfusion in their life, and less than 1 in 4 donate in the United States. Like, it is a serious issue that we face in healthcare. There's provider confusion around that. Again, delays in care. I think about delays in care because what if they are just adamant that they need someone to explain this to them in the hospital, and maybe it's a community hospital, not an academic center, where they don't have transfusion consultations that come sit with them and talk to them about these things, right? Or a family member raises it in a trauma situation and they're like, oh, no, because is it unvaccinated? It's like, by this point, or we're at, they've lost 3 pints of blood. Like we've activated trauma protocols. Like, and it becomes just this crazy situation. I think it's bigger than just, oh, this one state's introducing maybe a bill, right? Like there's downstream ramifications of even these types of things being talked about as plausible.
Yeah, I agree with that. And just the fact that how much the laboratory does touch every one of us in our care and how we live our day-to-day lives. That's kind of something to kind of just keep in the forefront of your mind. And the reality is that most people don't understand the rigor behind blood safety systems that are already in place. So all the regulatory things for our AABB, for any of the accreditation bodies that are kind of coming into play for hospitals, for the laboratory itself, blood products are highly regulated to the point where if there is what we call a transfusion reaction, where there is a fever or there's something that's actually happening, it's being investigated very thoroughly. They're sending more people in. So it's something that from the outside, it's easy to not see that, especially if you aren't even in the laboratory, if you're not in the blood bank, you don't see that from a day-to-day kind of perspective. So these are just some of the realities. So people don't see the layers of testing. So even the screening that's going on and at every part of the laboratory, they don't see what it takes for us to bring up any instrumentation or any tests that we're doing, all that work. Some of our younger lab professionals, you'll learn more about the difference between a verification, validation, but that is a different episode. We are not transfusing that right at this point. But they don't see this diligence that's going on, this hemovigilance. I love that. For the infrastructure that's there, but we do. So it's our job to kind of help get the word out.
Yeah, that's exactly why you listening, if you're a lab professional, your leadership in this area matters. In moments like this, you are uniquely positioned to translate the science, to explain, like Ron said, the layers of work and validation that go behind everything we do. You are positioned to clarify that brisk and then bring all of that calm, evidence-based perspective to the very loud conversations that are happening online. And, explain those things to people, because what we do, like I said, it's very nuanced and it's not easily put into a 1 or 2 sentence comment box. The information environment, because in this environment, silencing the experts creates noise for the people who aren't. So we need your voices in those comment sections.
Yes, we do. And our encouragement to you is that you stay curious and obviously evidence-driven, but don't let urgency replace accuracy. It's okay to pause. You don't have to be the first to reply, right? You can take the time to say, wait a minute, let's really dive into this. Do the lab check first, right? Take our advice there. And at the end of the day, our credibility as laboratory professionals is one of our most powerful tools. We need to be respectful with that. Great power comes great responsibility. I stole that from Uncle Ben. So we have to use it wisely later. Yeah, really Spider-Man later. We have to use it wisely. And our hope is that we continue to lead with science, even when the internet's moving at full speed. So from all of us at SUPERSTAT, have a great rest of your day. Thanks for listening. Like and subscribe.